UCLPartners has an absolutely critical role, I believe, in supporting the development of the future NHS workforce. Two reasons for that. I think firstly, we are a partnership and therefore we're in a great position to facilitate collaboration across organisations which otherwise find it very difficult to work together. And the second thing is we're not bound by any of the limitations of the other organisations in terms of new thinking and radical thought, and I think that's what we can really bring, shake up the system, doing something really different.
Working practice in the NHS are changing, but they're changing a bit slower than we need them to. There's a lot of evidence and a lot of discussion about the need to completely transform the way that care is delivered, and education needs to follow that, but there are a number of barriers that make that quite difficult. Having said that, there's a lot of work about people working in teams, about people supporting each other, and about people recognising the primacy of different roles within a team.
There's going to be quite a few hot topics, and I think the big hot topic is about change. We're going to have resource problems in the future, there's no doubt about it. So we need to be able to manage what we've got now more effectively than we have been doing in the past. And to do that, you need leaders that can actually manage that change and take their staff with them.
UCLPartners, as an academic health science partnership, has an increasing and exciting function within education, and since around 2012 we've been developing education programs for health professionals across the whole sector and outside.
There are lots of reasons for us to work in partnership, but one of the key ones is how we can meet the needs of the workforce by getting a very different perspective again from individual organisations. One of the key future needs of the NHS is to work collaboratively across organisations, so integrated care, for example, physical and mental health, care for patients, so mixing up things which become very segregated. UCLPartners can have that viewpoint because we work across those different areas and those organisations. I think we're absolutely in a vital position to help support the workforce develop in the way it needs to.
Yeah, I mean, I think we've got to be passionate and committed to this way of working, because the patient and care and community have got to be absolutely at the centre of everything that we do. And I think this newer way of approaching education has just got to be the way forward. So that's where we stand.